Pudendal neuralgia. Pudendal neuralgia is a condition that both men and ladies can get. It's caused by an irritation or an overactivation of the pudendal nerve. The pudendal nerve is one of the nerves that comes off the nerve roots at the base of the spine. It's formed from the branches of L2, 3 and 4 and comes off part of the sciatic nerve. The pudendal nerve is quite unusual because it carries both sensory and motor fibres, so that means it tells the muscles that it innervates what to do, and also it carries sensations, so pain, touch, temperature and so on. And it's got some autonomic function as well. So autonomic means the automatic processes that our bodies are involved with, and that can be things like bowel function. It can be involved a little bit with bladder control. It can also be involved with sexual functions such as orgasms or erections. So people who struggle with pudendal neuralgia usually have pain associated with an irritation of the areas that the pudendal nerve supplies the sensation to. So that's generally your pelvic floor, which is the sort of what I would consider the underhand saddle area of your bottom and your genitalia. And you can also have some shooting pains occasionally going down your legs. And so if this nerve becomes irritated or overactivated, you can experience quite severe neuropathic pain, so sharp, shooting, burning pain. Because you have two pudendal nerves, one on the left and one on the right, often the pain can be more predominantly on one side than the other. But it's not uncommon to have pain on both sides, particularly if the process that's resulted in it occurs in both. Nobody knows exactly why people get pudendal neuralgia, but sometimes it can be caused by stretching of the pudendal nerve, particularly in cyclists who adopt a position where the pudendal nerve can be stretched. It can also be caused by sitting down for very long periods of time, and we all know that as a society in general now we tend to sit a lot more than we ever did before. It can be caused by trauma, particularly during things like childbirth or labour if there's a long second stage, or it can be caused by just a very, very tight pelvic floor. So that's the muscles that supply and hold the internal organs down through the sort of bottom of the and your genitalia and things like that. And there's also some suggestions that irritation or activation of your pudendal nerve can be caused by hormones, such as going through the menopause, or even indeed endometriosis. So pudendal neuralgia is really quite a debilitating condition because you can have sharp, shooting, burning pain at any time, can be unprovoked, and is made worse by sitting down. Quite often the pain is relieved by standing up or lying down and sleeping and things. But it's not always relieved by that, and quite often sleep at night can be really quite disturbed with it, which is often the case with a lot of chronic pain conditions. Because the pudendal nerve supplies the muscles of the pelvic floor, so that's the muscles underneath that hold your internal organs up and in, if the pudendal nerve gets irritated or activated, that causes these muscles to get really, really tight. And we all know that when you get tight muscles, if you get in your shoulders, the tighter they become, the more the pain evolves, the worse the pain becomes. And these muscles then squeeze really tight, and because the pudendal nerve comes out as sort of three branches and it sort of forms a sort of almost finger-like projection through these muscles, the tighter these muscles squeeze together, if the nerve is going through it, these nerve branches of the pudendal nerve then get squeezed and tightened even further. And so you can quite easily fall into this vicious circle where you've got pain, the muscles get tighter because of the pain that's there, and that squeezes the nerves even more, which causes more pain and more tightening of the muscles. So it's one of these conditions, if we want to try and treat it, we need to try and break it down, and we need to look at medication, and predominantly anti-nerve pain medication. So the anti-nerve painkillers, we need to look at those to try and relieve the irritability and the wound-up nature of the nerve pain. And we also want to look at some physiotherapy, particularly looking at the pelvic floor, trying to relax the muscles of the pelvic floor, and then potentially looking at any other therapies that can reduce the overactivation of the nervous system, whether that's psychological therapies or just simple relaxation exercises. And often the condition can be brought back to a much more manageable state. Very occasionally we can do injections, particularly if it's really, really severe, to try and just relax the muscles and to reduce the irritability of the nerve.